Hey, Dr. Josh Bletzinger here, and I want to take a few minutes of your time to discuss blood chemistry. If you've read my blog, or if you are about to read my blog on what does your blood chemistry tell you and why, I pretty much differentiate what blood chemistry means and why it's taken between the conventional medical side and the functional medicine side. And so typically when blood is taken from your PCP or your GP, we're looking for symptoms, or we're trying to identify what might be going on in your body based on your complaints. We're trying to justify possibly a drug therapy model or confirm a diagnosis based on your symptoms. And the other thing with that conventional blood draw is that typically you're only being run blood panels that are going to be covered by your insurance. So it gets really limited, and most people think that it's really expensive to run, so I want my GP to run the blood so the insurance pays for it. On the contrary, the functional medicine side of looking at blood chemistry is to turn possibilities, so things that are possibly going on, into it's probably going on. So in the functional medicine model, we're looking for causative factors to why there might be body dysfunction. So we're not looking at blood chemistry in a way that we're looking for disease processes, but we're looking at blood chemistry to improve health and to optimize function. So when I run a blood chemistry panel for a patient in a functional medicine model, I'm looking at this in a broad view. So I call blood my broad-based testing. Why? Because I want to understand what might be going on and what in my process is going to help hone me into possible specialty tests, or if there's enough information in there, I'm going to get the where is something going on, where is dysfunction likely, and it's going to give me an indication to possibly why. It's not going to give me the how, it's not going to tell me how to treat it, but it's going to give me the where and why of possibly what's going on. And so I'm going to help explain that here in a blood chemistry test that I'm going to review here real quick. I'm not going to go into specifics, but I want you to understand exactly how I review this, and we're going to give some differences here into why functional medicine evaluation in blood is pretty cool and is going to give you a huge insight into what's going on. So I'm going to switch my screen here. So we're looking at, now we're going to look at some blood chemistry panels. So this one specifically, with permission from the patient, we had this test run through Quest, and there's 4 pages of elements and substances that we ran that are indicative of your blood. And so you're going to go and you're going to see the different areas here. So you're going to see lipid panels, so you're going to look at cholesterol. In this instance, I ran high sensitive C-reactive protein, which is an inflammatory marker, homocysteine, which is another inflammatory marker. We're looking at some metabolic panel here, so comprehensive metabolic panel, going through that. Electrolytes, kidney function, protein levels, as well as liver markers. We're going to get into A1C, so we're looking at the amount of blood or sugar that's spontaneously attached to the red blood cell, so it'll give you an indication for diabetes. Some elements here, so magnesium, lactate dehydrogenase, another liver enzyme, thyroid system, complete blood panel, so we're going through red and white blood cells and looking at some immune function as well as vitamin D. So this is a basic panel that I would run on a patient to give a full spectrum, a broad idea of what the particular body systems are doing, and ultimately starting to make some decisions on exactly what we might be able to do with this patient just on this blood evaluation. So the interesting thing here first is when we're taking the elements from this blood panel here from Quest, just if it was Quest or LabCorp or the hospital is running it or your doctor's office running it, you're always going to get this reference range. And the reference range it's a range. So if we look at materials in the body, so if we're looking at some of these electrolytes, so for instance sodium has a reference range between 135 and 146. Now some of them can be a little bit closer together, some of them can be very, very broad or very wide. So you're looking at alkaline phosphatase that'll go from 40 to 115, and that would be the reference range. Now what's interesting on the reference ranges is that reference ranges are a mean and 2 standard deviations on everybody that takes the test, either healthy or in disease processes. So this is everyone in this region at Quest that takes this test, and they're creating this reference range based on that mean and the first and second standard deviation. So the difference between conventional medicine that looks at this and says, you know what, all this stuff looks good. You know, you're not showing any highs or lows other than in your cholesterol, which, you know, if you're seeing cholesterol here, you know, we might want to consider a statin, again, into the drug therapy model. But other than that, it's not giving you anything other than saying, oh, you know what, your blood chemistry elements here are within range, and there's really, everything looks pretty good. And so the difference between that and how we're going to evaluate this from a functional medicine standpoint is I'm going to group these elements into body systems. So this is what I've put together for myself and how I evaluate patients, is that we're going to be looking at specific systems. So blood sugar system, we're looking at lipids and inflammation, we're looking at thyroid system, we're looking at complete blood count, we're looking at minerals and electrolytes, proteins, enzymes, wastes, and then I have a number of different calculations that I like to do to find hydration patterns, how long red blood cells live, and the list goes on. So the difference here is that when I take my different systems and I plug in the numbers, I'm going to be working on optimal ranges. Now, optimal ranges are a thinner, more comprehensive, and closely niched reference range that are based on many, many studies for different body systems and different functionality. And I want to make sure that I see that these numbers are inside of these ranges. And so I'm not going to pick this one apart, but ultimately then what I do is I start to, when I plug these numbers in, I'll look at these optimal or functional ranges. And if they're out of range, I'm going to turn possibilities into probabilities. So when we're seeing things like C-peptide being low, I'm going to look at the next step into there and plug that in with glucose into a HOMA calculator and see if there's insulin resistance, if the beta cell sensitivity in the pancreas is working correctly, if we're producing enough insulin when we eat, and then we can break that down. When we're looking at lipids and inflammation, cholesterol is going to give you one snapshot of the whole situation. We're also going to want to look at lipoproteins because that's what carries the cholesterol around. And I'm also going to put this into ratios to see if anything comes up in here as far as possible insulin resistance, cardiovascular stress, inflammation, liver dysfunction. So there's different areas within the inflammatory markers that I can look at and see if this is cardiovascular stress or liver dysfunction. And then we want to further test or see some other elements to see if we can turn these possibilities into probabilities. We're looking at oxidative stress such as uric acid. When the thyroid system, typically the only thing that's ever run in thyroid patients is TSH, maybe total or free T4, but we have 10 different markers in the thyroid system, including the antibodies, to understand exactly what the thyroid system is going on, and if we're actually converting the thyroid hormone down into T3, which is the active form of the thyroid that acts on the nucleus and the DNA of the cell, which controls our metabolism. When we get into complete blood count, we're going to be looking at red blood cells. We're going to be looking at the color and the size of the red blood cells, and we're going to look at iron with that. So we're going to be looking at anemia patterns. So if you have macrocytic, microcytic, normocytic anemia patterns, if this is a B vitamin deficiency, or if we're actually having some sort of hemolytic anemia where the blood cell is actually being destroyed, and that can give us a possibility into a probability. So we're not just giving somebody iron if they're iron deficient, and it should be a B vitamin that they should be getting. So we're going to be looking at it in that form. When we look at the white blood cells, we're looking at the immune function from a 32,000 feet scope. And so we look at white blood cells, and then we're going to draw out the individual white blood cells such as neutrophils, lymphocytes, monocytes, eosinophils, basophils, to understand what type of things can be going on. Is there some sort of bacterial subclinical stress? Is there a viral pattern? Is there a possible parasitic pattern? Is there inflammation that our white blood cell system is giving us an indication of? When we get into minerals and electrolytes, we're looking at sodium, potassium, carbon dioxide, chloride, giving us an anion gap. So we're looking at some hydration patterns, if we're getting enough minerals and electrolytes, as well as some of our other ones, possibly magnesium, zinc sometimes we're looking at that, calcium. So I'll plug in the numbers that I get from that. We're looking at proteins, so this is going to give me a good indication on digestion and liver function to see if these are out of optimal ranges and why. Enzymes, so we're looking at specific liver enzymes to give us an indication if there's liver stress and possible detoxification patterns, or if we're developing a fatty liver. And then we can correlate that with symptoms and health history to understand exactly what might be going on. And then we're going to look at waste. So how well are your kidneys functioning and how well are they getting waste out? If we're building up nitrogen, we can look into the diet, understand what type of protein intake we're doing, why we're not breaking that down. And then ultimately, if we're taking a full panel, we're going to get some bile acids and understand, again, another component of liver functionality. But what you can see here is this is a way different way and a modern way of looking at blood chemistry to identify what is going on functionally with the patient in order to get them back to the foundations of their health and or optimize their health. So when I evaluate from a clinical standpoint with symptoms present and looking for specific goals, we want to look at this in order to help give an indication on what other specialty tests we might need to order, or if we're getting enough data here on how we're going to start treating from a nutritional and supplemental standpoint. But also in the performance world for high-level athletes or people that want to take their performance to a next level, we're going to use blood analysis and hormonal analysis from blood to understand what we are dealing with and how we can help people that are looking to optimize their health achieve their goals. And then we use this as a baseline. So better than any other test, we're going to keep an eye on how our successive or progressive blood evaluations compare to our first one, because that's going to help us continue to do the right treatment strategies and nutritional strategies with our patients, because that's what functional medicine is all about. We're looking at the baseline of that patient and we're seeing how they change with different strategies, both in the nutrition and supplemental and lifestyle world. So when we get subsequent blood tests, we can see how they've been changing, if our treatment strategies have been working, if we're achieving our goals, and how we need to change it. Because ultimately, at the end of the day, the end of the road, we want to continue to improve the vitality and the performance and the wellness of the patient, and that's exactly why we do these tests. When you look at this from a conventional perspective, if it's out of range, we're pinning that with a drug therapy model, and that's really the end result. Is the drug therapy working? Is it keeping you in standard norms? If not, we have to up the dosage, we have to change the therapy, and you have to change your diet, and you have to exercise without any real concrete direction or strategies. So I think within this video you can see here what the difference is between analyzing blood in a conventional standpoint and a functional medicine standpoint, and ultimately how much depth we go into here to find out exactly what we can do to either restore the foundations of health and body and system function and or optimize performance. So if you are looking for a thorough and comprehensive blood evaluation, and if you've had blood pulled, I'm happy to look at that blood. I'm happy to do an analyzation for you, get on a 15-minute call, see what I can do for you. If you don't have this amount of blood pulled, I use a specific professional co-op that we get wholesale prices at, so we can get elements, blood panels, and different blood chemistry pulled at wholesale prices. And that link is in my blog as well, so you can investigate that, and then we can get into an analysis system and start to help you achieve your goals, or look at the objective side of your health through blood chemistry. So if I can help you out, I'd be happy to. Dr. Josh Bletzinger, and I look forward to speaking with you soon.